Good evening, everyone, and welcome. I am Leanna Levine Reisner, the Network Director of Plant Powered Metro New York, and we're so excited to welcome you here this evening to learn along with two physicians from Plant Based TeleHealth. Our role in the community is to empower people to find better health and overcome chronic disease through whole food, plant-based nutrition. And it is true that with plants, we all find paths to healing that we never even considered were possible before. I'm excited to bring you more information specifically for women. So many of us struggle with all sorts of health issues. We are not unique from men, but we are different, and our particular health needs require a different touch. So we'll delve into a lot of those topics tonight. I want to say a few words about Plant Based TeleHealth, who are our partners tonight. Plant Based TeleHealth is a national telemedicine service that's focused on the prevention and reversal of chronic disease using lifestyle medicine, of which plant-based nutrition is a major component. They provide access to plant-based lifestyle medicine across the United States. They have doctors now available to see patients in all 50 states across the US and internationally using secure video conferencing and patient portal technologies. A doctor in one location can deliver in-person care to a patient at a distant site. They're making lifestyle medicine available nationwide using telemedicine to remove many of the barriers that prevent people from accessing this type of care. Joining us this evening, we have Dr. Elisabeth Fontaine and Dr. Kim Scheuer. Dr. Fontaine is board certified in OBGYN and lifestyle medicine, and she's a fellow of the American College of Lifestyle Medicine. Her pre-medical background was in obesity management and exercise physiology, while practicing as an OBGYN and lifestyle modification with amazing results. Dr. Fontaine started a lifestyle medicine clinic and became the medical director of lifestyle medicine at a community hospital and a founding member of Rise VT, a community collaborative embracing healthy lifestyles. Welcome, Dr. Fontaine.
Thank you so much.
Thank you. And Dr. Kim Scheuer is board certified in both family practice and lifestyle medicine. She also has a master's in education, as she feels that to be a good physician, one should be an educator first. She's conversant in Spanish and American Sign Language, which she uses to bring her knowledge to multiple communities. On her journey, Dr. Scheuer has transitioned from the traditional medical group she ran and worked in for 20 years in Aspen, Colorado, to her lifestyle medicine practice at Dokes Lifestyle Medicine, DOKS Lifestyle Medicine, with her partner Derek Olson, who's a nurse who has also benefited from lifestyle medicine and a whole food plant-based diet. She has facilitated several complete health improvement program courses. Welcome to both of you, really accomplished, wonderful physicians who have made tremendous transitions and now find yourselves practicing medicine, I'm sure, in very different ways than you ever have before. So could you please tell us briefly how you got to this place? What brought you to lifestyle medicine? Dr. Scheuer, let's start with you.
Well, thank you so much for this opportunity to talk to your folks, and I really appreciate it. So I was in traditional family practice for over 20 years. When I was 47, I realized that my mom had had breast cancer when she was 48. And I thought, how am I going to prevent myself from having breast cancer? And at the same time, a friend of mine went to nutrition school, and I was a Milky Way vegetarian for most of my life, had struggled with weight issues, etc. And she came back and told me, you eat terribly, because I ate a lot of processed foods. And she helped me transition to a plant-based diet. At the same time, I watched Forks Over Knives, read the China study, and started learning about this. Changed my life, changed my patients' lives. And now I decided I wanted to live the lifestyle I prescribed for my patients. And I do now. And it's awesome.
Fantastic. Thanks, Dr. Scheuer. And Dr. Fontaine, how about you? What brought you in?
Well, thank you. I'm happy to be here too. And the topic of women's health, obviously, being an obstetrician gynecologist, pleased me quite a bit. So I think you mentioned a little bit, I'm an obstetrician gynecologist, but in my background of exercise physiology and obesity. So I've really tried to help as much as possible my patient during their, during the time that they actually grew with me. And I was really looking for something more than what I was doing. I was helping them with nutrition and exercise. And I discovered the American College of Lifestyle Medicine. And I've learned the very first time I went, it was kind of 2011. We were a very small group at the time. Ornish was there. I learned about the impact of plant-based. That was it. Turned everything around. Came home, 2 kids, my husband, and I said, we're going to do this. We're going to do a 21-day trial, and thought that I was crazy. But hey, my 2 kids are plant-based. My husband is probably a good 95%. And, I tried as much as I can to influence positively my patient. And with the plant-based telehealth, it's even better.
Fantastic. Thank you. Can you tell us a little bit about, when you think about women's health overall, why are plants so helpful? What's unique to women that a diet of wholesome plants can support? Dr. Fontaine, can we start with you?
Yeah. So, earlier you mentioned as an introduction the importance of plant-based, of reversal, preventing chronic disease. And this is true for men and women. But women, like you said, are a little bit, obviously we're different slightly. And we have other, I wouldn't say disease, but other element that sometimes makes it a little bit complicated for us, introducing some, heavy period, acne, PCOS, menopause, anxieties that we will discuss, I believe, a little bit later. And there's more and more studies that demonstrate that when you eat a plant-based diet, you improve substantially all these conditions. So, the importance for me here is to try to understand women that you don't have to wait to be sick or having a problem. Plant-based telehealth, all the physicians, including Kim here, use lifestyle to help you to attain optimal health. So we look at your entire lifestyle, and we really want to improve every single element, not only the diet, but everything else, the important pillar of the lifestyle. So I will start with that and see if Kim wants to add a little bit about that.
Yes, go ahead, Kim.
So I agree 100%. As women, one, we influence a lot of our families. 2, we do have more hormones going in different stages of our lives, whether it's puberty or menopause. I was actually looking forward to going through menopause because I wanted to experience what my patients experienced. And I had gone plant-based just before menopause. Didn't have any symptoms. It was great. And I attribute a lot of that to getting away from the exogenous hormones from all the cheese that I used to eat and all that. And I just had a very easy transition. And so that's one of the easy things for women specifically, but osteoporosis, my bone density went up. So we have to deal with that when I went plant-based. And my knees didn't stop hurting. My cholesterol plummeted. I mean, things that are typical for both men and women are like that, but we also have the other hormones that we have to deal with. And it's just wonderful for women and men, but women in particular, to get on this lifestyle and be able to support their families and themselves better and the world.
Absolutely. And in my experience, which I failed to mention at the beginning, I also put my endometriosis symptoms into, I guess you could call them remission. I don't experience my cycle as I had for 15 years prior. And I really attribute all of that to diet. There were no other changes in my life, but eating more plants and eating them less processed. And I think it, like you said, Dr. Scheuer, these hormones that we are exposed to over the course of our lifetime really matter here. And I know we'll dig into that as we go through a few different conditions that have bubbled up as important ones that I think we should address. So let's dig in. And as you mentioned, bone health, a number of our viewers told us that they're really curious to talk more about bone health. And this is a key topic, whether you are 60 or whether you're 20. And I'm curious to Dr. Fontaine, if you could tell us what aspects of our diet and lifestyle will really be helpful to help women of any age with strong bones and to reduce frailty when we do get into our older years.
Yeah, thank you. That's such an important topic and question. So our bone health kind of, increase and get better until about 30, and then it goes down, and we face what we call, bone fragility as much as losing muscle. when we get to what we call osteoporosis. And probably one of the biggest things to remember is prevention. So it is important that we continue having this good diet during all our life, associated with some kind of weight-bearing exercise to help the bone as well as the muscle. So in the diet, when you eat a whole plant-based diet, there's element that consists of so many color there, but you need the calcium and you need the vitamin D. And you need to make sure that people understand that the notion of thinking that milk and all these products has what we all thought it was like that, had the best calcium. They do have calcium, but majority of studies have proven that the people that eat a plant-based with calcium that we eat in the typical food, like greens and tofu and fortified plant-based meal, actually help better than any regular milk that we can take. And therefore, that is probably the biggest message. So prevention, weight-bearing exercise, calcium, vitamin D, which most of the time is better with the nature, meaning you go outside about 15 minutes a day without the cream and get the natural vitamin D would be even better than having to take a supplement. But these things are excessively important. And so prevention is the message here.
Great. And once someone has a diagnosis of osteoporosis or even osteopenia, what do you recommend that they do? Is diet going to be effective in that circumstance?
Well, I think Kim just mentioned that for her, she had her bone density measured, and once she started eating more whole plant-based, it improved. So this is a good sign, just maybe one person, but if you do, turn around and eat a whole plant-based diet and reinforce a little bit more of this weight-bearing exercise. So that doesn't mean going to the gym and lifting 200 pounds. Walking out with a backpack that has a little bit of weight in it, or walking around with 2-3 pounds in your hand, just to make sure that you stimulate the muscle, which will help also the bone, is definitely something that will help in the case of osteopenia and osteoporosis. And of course, it's important to discuss it with your regular doctor. For us at Plant Based, we make sure that they continue with their primary care, and we're there to support and making sure that we work together.
That's great. And so you mentioned to get proper calcium from your diet, leafy green vegetables, from tofu, from some of those fortified plant milks. I'm sure there are other foods, but is there something else about our calcium requirements that changes when we don't have animal foods in our diet anymore? Do we still need as much calcium as we did prior?
It's the same thing. We need definitely the same. You have to realize also that the calcium that you eat through your diet is much better absorbed than any supplement. And at some point, unfortunately, we had in the literature saying that if you take a little too much of calcium supplement, it could be detrimental a little bit for at the level of cardiovascular. So we got to be careful with what we're doing with supplements. So please eat as much as possible of a whole plant base that has calcium. And there is plenty into a whole plant base.
Fantastic. Thank you. So Dr. Scheuer, let's move on to another topic. This is a heavy one. So we'll get into, I don't know if anything's light in this conversation, but there's hope in all of the discussion. But women are particularly affected by Alzheimer's disease in older age. And it's actually been estimated that about 2/3 of people living with Alzheimer's disease are women. A lot of people are associating aging with cognitive decline, that we take it for granted. We think it's a given. But tell us more of this story. What aspects of our diet contribute to cognitive health, and can we actually prevent dementia and Alzheimer's through what we eat?
There are a lot of studies going on now. Dr. Dean Ornish is seeing if he can prevent and even reverse early Alzheimer's with lifestyle, which includes healthy eating, exercising, stress reduction, loving, having community, having a sense of purpose. That's very important. And diet is huge on this. It's not only what you eat, but it's what you don't eat. You want to make sure you're not getting the toxins in. Like you don't want to be smoking or having alcohol, which can worsen Alzheimer's. You don't want to have high saturated fat foods or high inflammatory foods, which can cause more inflammation in your brain, dementia, etc. The Scherzais, Dr. Scherzais, him and her have a great Neuro 9 is what they call it. And it's the foods that can help prevent and even treat early Alzheimer's, but prevention for sure. Again, just like osteoporosis, prevention is the key, but you can even improve this. And they talk about green leafy vegetables, whole grains, nuts, seeds, beans, so lentils, legumes, cruciferous vegetables, berries, herbs and spices, and tea, green teas, which have a lot of antioxidants. So those are their Neuro 9. And again, Dr. Ornish has some studies in process now. He said they're not finalized yet, but looking pretty good. So we'll have to see. But you want to do, you want to avoid the toxins. You want to increase your blood flow to the brain, decrease the cholesterol buildup, and just be as active as possible and engaged as possible.
Fantastic.
Can I add a little bit to that? Do you mind?
Yeah, go for it.
Talking about the Scherzai couple, if people in your audience are really interested, they have family history, Alzheimer, dementia, you should check their website. It's pretty interesting what they do for work. They have an academy, they have an app for the question and determine. So it might be extremely helpful and classes to support. So please take the time to review. It's Scherzai, Sher. Yeah, I think you got it. Scherzai, you spell it. We need to have that there maybe for your audience so that they can see it if they have any family history and would like more information. They're very, very good.
Great. Yes, we'll put that in the chat box in due time, very soon. And I guess one question that we have, obviously, we want to try to learn more about how to prevent Alzheimer's and dementia. For those who are perhaps caregivers for somebody who's going through this difficult period, is there anything that can be particularly health supportive of somebody who's dealing with those symptoms right now? Diet or lifestyle? Mm-hmm.
So getting in groups, support groups that help the caregivers is huge, because they can give you tips on little tips and tricks on how to keep things very stable for your family member who you're taking care of, or whoever else you're taking care of, and little tips and tricks of like for how to keep, how to bathe them in the morning early, how to get them involved in brain stimulating activities, how to get rest yourself. It is so important as a caregiver to take care of yourself first, because you can't take care of somebody else unless you can take care of yourself first. And that means you'll need time. You'll need good sleep, which is difficult if you're the only and primary caregiver, getting some help in from friends or family, cooking and having good food for the person you're caring for, but for yourself, getting outside in nature, as Dr. Fontaine said, getting outside in the sun and in nature yourself so you can be able to caregive. Meditation, breathing techniques. There's a lot of good things, but I find that the Alzheimer's support groups are phenomenal to be connected with a group of people who understand what you're going through.
Mm-hmm. Fantastic. And I think this also harkens back to a lot of things when we think about women's role in our families. In many cases, we are the emotional stabilizer of our lives, and we are there to support others always. We're often in a caregiving role. So let's transition. Talking about cognitive health is one thing, but our emotional health is also really critical. And in the same way that Alzheimer's shows up more often in women, women seem to also be twice as likely as men to be diagnosed with anxiety and depression. So emotional health is, of course, this broad category, and some of the more extremes of it may fall into anxiety and depression. But can a whole food plant-based diet help us to restore our resilience in these ways, both emotional health and mental health. And Dr. Fontaine, would you start us off with this?
Yes, thank you. This is such an important topic, and you're absolutely right. The whole plant-based diet, we have studies now that demonstrate the impact and reduction of an anti-inflammatory diet, so a whole plant-based diet, reduce anxiety, improve and prevent depression. You know, if you say why women more, most likely a little bit of hormones play into this. And again, if you eat an inflammatory diet, you probably substantially increase a little too much estrogen, which potentially could put you at higher risk of different elements, including anxiety and depression. So the thing that you have to think sometimes is why is this connected? So whatever you eat, you have to think that your gut, there's a big connection between your brain and your gut. The gut is a huge endocrine system. We have about 30 trillion of different organisms there. And if you eat an inflammatory diet, these organisms don't seem to be reacting so good, and we create what we call dysbiosis. So inflammation, usually there's a good connection of these elements when you eat the right thing with the brain that signal something very positive, like those small fat acid chain are very important. And if they're not produced naturally in the gut going up to the brain, then it increases your risk of anxiety and depression. So bottom line is, if you eat a whole plant-based diet, we have more and more study that confirm that you can substantially improve, reduce anxiety and depression.
Amazing. Are there other ways that we can support our emotional health? What are your go-to strategies when you have patients coming to you who are, feeling frayed, let's say? Dr. Scheuer, what do you like to recommend?
So I love exercise and being out in nature. There are some really good apps out there that help you with like Calm, or that help with breathing techniques. So that's a big one for me, is like just breathing in for 4, holding for 7, out for 8. If you do that 4 or 5 times, that's worked as well as Xanax. They've done some studies on that. So there's breathing techniques, self-meditation techniques, sleeping techniques. Dr. Judd Brewer has a really great app called it's an anxiety app, which is cheap and easy to follow, and you can put it on your phone. So if you're nervous at a certain time, or if you have something going on, that's a great way. Talking to people, there are lots of great therapists out there, and at Plant Based TeleHealth, we have lots of connections to people that can help. But eating healthy helps increase your serotonin and decreases the inflammation. As Dr. Fontaine said, the inflammation that is in your food goes into your body, which goes into your brain, which causes more depression and anxiety. And so a multi-tiered system for that one.
Fantastic. And we just shared in the chat box Judd Brewer's resource, Unwinding Anxiety. I think that's what it is, Dr. Scheuer. Excellent.
Yeah.
Very good.
Too. I was like, okay, we couldn't remember, so perfect. It's a good one.
That's great. I love it. And just this breathing in on 4, hold for 7, out on 10. Is that right?
8. 7 and 8.
Out on 8. Okay, perfect.
8, yeah.
4, 7, 8. Just practicing that, I'm sure, will bring some calm. And I love how, obviously, when you're doing yoga or when you're doing other kinds of meditative practices, the breath is so important. Mm-hmm. There's so many strategies out there. So finding the ones that work for us is part of the fun of it, I guess.
Yeah, we live in a society. It's not only diet, but the society we live in is just keep moving, going. We're just overloaded by work, lack of sleep, and too much information. People, I'm sure that, they come to see us with so much information. I can barely follow. The Google Doc of this word is sometimes a little over. So that makes it a little bit overwhelming for the brain. We have to be able to give the chance to restore and just take one thing at a time, and then improve the diet, the sleep, the stress, exercise, optimal health. That's where we're doing.
Fantastic. So let's transition now to talk about weight. Women talk about weight, we think about weight, we perseverate about weight quite a bit. And of course, many people think that weight gain is a part of aging or having trouble losing weight after you pass a certain age threshold, especially post-menopause. Can you tell us the real story here? What can plants do to support a healthy weight loss or healthy weight maintenance? Dr. Scheuer, will you kick us off?
Absolutely. Because weight was such an issue for me since I was 13 years old when I stopped growing up and started growing out. I struggled all my life, and I love to eat. And I've done everything from not healthy stuff, like trying not to eat for 2 weeks and things like that. When I went plant-based, which was right when I was premenopausal, all of a sudden I could eat more. I eat so much more because I'm eating high nutrient dense, low calorie foods versus before I was eating high calorie, low nutrient dense foods. So I'm never hungry now. I eat way more than I used to. And it's just, the weight just poured off. I didn't even try. And it was wonderful. So there's a lot of great resources out there, but the real thing is calorie density. If you have a tablespoon of oil, that's 120 calories. Well, 120 calories of lettuce is about that much. And so you put this much in your stomach and it's going to fill it this much. You're not going to, first of all, there's very few nutrients. It's pure fat. It goes straight to, it goes from your lips to your hips, and it doesn't make you full. So you don't have the nutrients in there, and your body wants not only more food, but more nutrients. With high nutrient density, low calorie foods like plants, you eat and you're full. You're completely full, and your body has the nutrients it needs, so it doesn't crave anymore. And I was a food addict all my life, and I'm much happier now because I eat so. I'm now the person I didn't like, and it's great because there's so much I can say about that. But the plants are so great because they're fiber rich, they're water rich, they're bulkier, so you can eat it and feel full. And people think, oh, it just tastes like cardboard, but no, it's delicious. You can have so many varieties of foods that are plant-based, Indian and Thai and Mexican and American. I mean, just, it's wonderful. So there's so many reasons, but you come talk to me, I'll tell you all about it.
Thank you. And for somebody, we've seen in our own communities, and welcome to my daughter who's joined us for Women's Health Night.
Perfect.
Yeah, we're training them young. For some people who have been eating a whole food plant-based diet but may not be losing the pounds as readily, what are the recommendations that you make? What are the tweaks that will help to accelerate some of that loss?
So we definitely look at what they're eating very specifically, because I find a lot of people go vegan and they expect to lose weight. Well, that's not necessarily true, because vegan is great in terms of you're not harming the animals, but Oreos are vegan, sodas are vegan, oils are vegan. And so they're probably getting high calorie dense, low nutrient foods in there. So you want to go, so that's one thing we look at. We look at if there's other reasons that you're not losing weight. Do you have a thyroid issue, or there's something else going on? We look at any metabolic issues that might be happening. So if you come to Plant Based TeleHealth, and we'll help you with that. What I find more often is people who go plant-based end up either not eating enough and getting tired because they're not getting the calories, or losing too much weight and feeling like, people tell them, oh, you're losing too much, you're not doing well. And they're actually feeling great. They have great energy, but are a little bit worried about losing too much, and we can help adjust either way.
Great. Yes. People.
Can I add a little something on that?
Yeah.
So, Kim is right. Oftentimes what I see, women will go on that vegan or plant-based and not eat enough. So the important thing on that too is that your energy expenditure comes with what we call your resting metabolic rate. That represents 80% of your energy expenditure in a day. If you eat less and less and less, you're bringing your resting metabolic rate lower, and therefore you tend to be more efficient. And that's why sometimes it's difficult to lose weight. That seems to be crazy, but you're losing muscle mass. The muscle is what is, spending your energy. So if you eat a little bit better, you're probably going to lose some more weight and add some exercise to it to build the muscle. It's well known that when you do exercise, you increase your resting metabolic rate for a good 48 hours, goes down, so it always play in a higher level. So eat better to build muscle and exercise.
Excellent.
There's lots of tips. Like Dr. Michael Greger has a great book called How Not to Diet, which he has some tips there. We can, if people aren't losing weight and they want to kickstart that, definitely the exercise, but also when you eat and how you eat make a difference. So we have those tips and tricks we can help people with.
Absolutely. And I think so many of us who have developed, let's say, poor habits during the age of COVID, when we're sitting around for too long and not getting out enough, I think learning about those tips and thinking about not eating after a certain hour in the evening. Do you recommend, having dinner and then calling it quits? Is that generally?
We all like the eat breakfast like a king, lunch like a prince, and dinner like a pauper. And eat, we most of us, I think, I can speak for all of us, say, limit the time that you eat. Give your body time to rest and recover. When you're not eating and when you're sleeping, you're recovering. So my suggestion is definitely don't eat after 7 p.m. if you can. And you'll metabolize an apple very differently at breakfast versus at dinner. And so you want to kind of have your higher calorie foods towards the beginnings of the day when you're really needing it. You don't need it to sleep. And it helps you sleep better too. It will help with weight loss. And so there's different kinds of, limited time, limited eating that kind of helps.
Wonderful. So Dr. Scheuer, you shared a great story about your sort of absent menopause symptoms. And I'd like to dig in now with Dr. Fontaine about how that can be. What else can we understand? How is it that Dr. Scheuer went through menopause and didn't have the symptoms that others typically have?
So we have some studies, that were done comparing, if you look at the Asian population versus us, the typical American diet had a tendency in women to have a lot more symptoms of menopause compared to the Asian, which now it's starting to creep up because they're starting to have our diet. So we knew that there was something about diet that was, making the difference. We didn't have that many studies, so we have a most recent study of Neil Barnard from the Physician for Responsible Medicine that had done a 12-week program on comparing two groups, and one was on a low-fat, whole plant-based diet with half a cup of soya. And after those 12 weeks, 80% of women said that there was no or a significant improvement of their hot flashes. So, we had this study on the different population that was suggesting that obviously the Asian had a different diet than us, much more plant-based forward than us. And they did not experience as much the hot flashes and what we encounter. And now we have a study, at least one, that is showing that, we can substantially improve hot flashes and in a short period of time, 12 weeks. So that was a significant result. So there is definitely, again, for anything we discussed today, we're going back to, it's a question of eating an anti-inflammatory diet is not only helping with chronic disease, but it helps in many, many conditions that women encounter related to hormones. So, we're eating an anti-inflammatory, we're helping the estrogen of not getting too high level. Because when the drop of estrogen happened in progesterone, when menopause hit, that's where the symptoms would happen. It's not every woman that has the symptoms, but when they're there, they're very uncomfortable.
Right. I was going to ask, how is it that this happens at all? But like you said, that if you start with a high level of these estrogens and then they're plummeting,
Yes.
that's where you're feeling the change. So can you explain, just for our viewers who may not understand this, what is it about eating animal foods or even eating processed foods that leads to high levels of estrogen in our bodies?
Well, this the most simplest way is to say that, oh, you say it's an inflammation, but when you eat more of the fat, you tend to gain a little bit more of the excess fat, and the fat is a kind of an organ that is also producing estrogen. So not only us gaining weight, but all the food that we're eating that are processed, are obesogene and have some estrogen that are stimulating from the exogen estrogen. So therefore, we're adding more to our body than what we really need. It's not supposed to be coming from the food; it's coming from our body that is producing. So by having a plant-based diet, we're not taking anything from outside, and we're producing our own estrogen. And therefore, when we get to the menopause level, there's not that substantial drop where there would be as much symptoms. Now, you still have women that will have symptoms even if they're on the whole plant-based diet, but let's say that it's a lot better when they favor a whole plant-based diet.
Great. And Dr. Scheuer, were there other aspects of your menopause experience that you can comment on here? Things that might help other women who are currently dealing with hot flashes or insomnia or some of the other common symptoms?
Well, I definitely agree with Dr. Fontaine. Soy is a huge help with menopausal symptoms. The other thing that helps also is fiber, increasing your fiber, plus exercise does too. So those are, and getting enough sleep. So putting this all together does make a difference for my patients who've had menopausal symptoms, but the soy is huge. It decreases the symptoms significantly in my patients.
Great. And that actually helps us transition into the next topic, which is cancer. And hands down, one of the most popular questions that we often get in teaching about plant-based nutrition is, wait a minute, can I eat soy? I was told by my doctor, or I heard that soy is causing cancer. Can you debunk that myth a little bit, Dr. Scheuer?
Absolutely. I researched this to the hilt when this happened, because breast cancer, I kept hearing that you can't have soy with breast cancer. And so I researched it a lot. There's a great book by Dr. Christy Funk called Breasts, the Owner's Manual. And she also had heard the bro science of, you can't have soy because it'll cause breast cancer. But if you look at the studies, you look at Japanese women, when they were not eating a standard American diet, their risk of breast cancer was nil. They'd come to America, they eat a standard American diet, their breast cancer risk went up to the same as American women, which is now 1 in 7, 1 in 8. And people think that soy is an issue because it's a phytoestrogen, which is completely different than estrogen. A phytoestrogen actually hooks onto the estrogen receptors. There's an alpha and a beta, and it hooks onto the beta and blocks estrogen from being on the alpha. And so it actually decreases the risk of breast cancer. And if you have breast cancer already and you eat soy, your risk of a recurrence or death goes down significantly with soy. So it helps with menopausal symptoms, it helps with breast cancer reduction, it helps with prostate cancer reduction, interestingly enough, and it does not decrease your testosterone like some men think. But, if you eat a plant-based diet, breast cancer and colon cancer are linked. My mother and my grandmother were diagnosed, my mother with breast cancer, my grandmother with colon cancer on the same day. And the doctor said, "Oh, isn't that sad that these are linked for you?" And I was like, besides being overwhelmed and sad, I didn't even think about that. But eating the plant-based diet, when you eat the plant-based diet, your risk of colon cancer goes down. So high fiber, the more you poop, the less risk of breast cancer you have. And on a plant-based diet, you tend to poop more. And so there's just so many reasons to go plant-based.
Fantastic. And it's probably more compostable, right? Right. We talked about how estrogen is a mediator in many of these female cancers, in menopause and in these cancers. Can we dig in just a little further? You mentioned breast cancer, you mentioned colorectal cancers. Are there other things that we know about female cancers, specifically uterine, ovarian, endometrial, other things that we see more commonly? What's the diet connection with those? And of course, fiber is going to be a key piece of regulating all of that and reducing risk. What more can we unpack for our viewers about these kinds of female cancers and food?
Yeah, the probably the one that you've been discussing that has a much more relationship with estrogen level is the endometrial cancer. So endometrial is the inside lining of your uterus. Cervical cancer, even ovarian, not as much. Cervical is really related with a virus of cervical cancer that we call HPV. So endometrial cancer, definitely high level of estrogen, because that helps. Obviously, estrogen is there to help with your period. And when you have too much, it triggers having a thickening of your endometrium, and eventually the cells inside could get a little bit disorganized and become thicker and produce what we call hyperplasia, which is a little too much. And then eventually it could change those cells to become cancerous. So too much estrogen, and often we'll see women that has obesity related will have a higher risk of uterine cancer. That's probably the most important one that we have to be very careful.
Thank you. And so you mentioned, Dr. Scheuer, also that for women who already have a cancer diagnosis or who are maybe a survivor of it, there are things that we can do with diet and lifestyle to minimize cancer's impact on our own lives and perhaps its recurrence. Can you speak more to that topic?
Absolutely. So there is definitely studies out there that say that exercise decreases cancer risk and cancer recurrence risk. There are studies now, the World Health Organization has linked any alcohol to cancer. So if you are concerned about cancer, or if you have cancer, get rid of the toxins. That's including alcohol, tobacco, making sure you get sleep, decreasing your stress, anti-inflammation, stressing less. Meditation can actually help. And I'm thinking of, exercise. All of the pillars of lifestyle medicine will make a difference. Having a purpose and a reason makes a difference in people who have cancer. So get involved with your community, get help that you need, and get the support that you need. Those will make a huge difference.
Thank you. So we're going to go to the younger side of things now. We'll talk more about menstrual health and fertility. And like in my circumstance, many women struggle with painful, heavy periods, or they have aberrant periods. Maybe they don't show up as they should with regularity. And people are having trouble getting pregnant. There are all these things swirling around. Dr. Fontaine, can you unpack this for us? Help us understand where nutrition plays a part in our menstrual health and in our fertility.
So it's so interesting to discuss that. So I've been an obstetrician gynecologist all my professional career, and I discovered lifestyle at the end of my career. So I didn't have that much information regarding that the diet could have such a huge impact. So I've seen all these young women with irregular period, like you said, heavy period, becoming anemic, having excessive pain, developing, like you had, endometriosis, PCOS, and difficulty, obviously, to get pregnant because their cycle was so irregular. And then you realize that by give them the chance to have, again, this anti-inflammatory diet, whole plant-based, help them to regulate all the the hormones in their body. And eventually that helps them to have a regular cycle, not as heavy, which for women allow them to be fertile, ovulate, and have a better chance for pregnancy, reducing significantly the cramp related with their period. The PCOS to substantially improve this condition that eventually just especially young women will have with irregular cycle and hair growth. That has such a huge impact. Having too much estrogen also stimulate the uterus, where you can have those benign growth that we call fibroid, which cause a heavy period again. So by helping them with an anti-inflammatory diet, it is a whole plant-based diet, we substantially reduce this. And again, the fibroid will substantially reduce in size, and their period could become a little bit more regular. Now, for some women, it will not, once the fibroid is too large, it may not have as much of an impact. But for the majority of women with a normal sized uterus, it's substantially changed. So I wish I had known all these information when I was a young gynecologist, but it's changing. So lots of good impact with anti-inflammatory diet.
Oh, you're
yeah, wonderful. I was going to ask you, obviously, with all of these conditions that we've talked about, some people will just have a tougher time. There may be circumstances that are beyond our control. And I think it's also, especially when we talk about fertility, which is such a touchy subject, people who've been on a long journey trying to get pregnant or then moving on to adoption. And then when they hear this information, that diet could be a root cause of their concerns and their struggles for so many years. How can we as practitioners of healthy eating present this information in a way that can bring open minds and compassion and not a lot of self-guilt? Because I think that guilt, women in particular, we carry a lot of guilt on our shoulders, and we want this to be an empowering message, one that gives people more control, and yet they've been through a lot. What do you say to that?
I think that, just say when they come to us, we already have the diagnosis that, they're trying to get pregnant. So obviously for us, it's already to be, have empathy and compassion regarding the situation and being able to assist them and help them into their choice, because it's their choice of saying, listen, I've tried everything, and now I heard that, being different with my diet, this could be helpful. So I think it's really in the sense of taking the time for us as a physician, as a practitioner, to understand. And I know I've seen many of my patients with infertility, which again, I mentioned, I didn't have all this information, and I wish I had, because it makes it is hard. But other than the diet, we certainly try to assist them as much as possible, because we know how difficult it is to go through infertility. And you're right, oftentimes it's the women that will have this guilt. So we have to be really present with them and help them to go through all this.
Thank you.
I mean, we didn't know. I didn't know till I was 47. When I found out about all this information, I was mad. I mean, it affected my life and it affected my patients' lives. So there is no reason that a woman should feel guilty about something that they didn't know about, because we have so many competing things going at us. We have big business. There is no big broccoli. There's a lot of things that go against what's right for us and what's right for society. So there's no reason to feel guilt about this. Just move on from now and do the best you can and teach your children so they don't have to go through this. And then I wanted to bring up one more thing you asked about cancers and stuff. One thing I forgot to mention is G-bombs. If you guys have heard about Dr. Blanking on his name right now.
Joel
Fuhrman, right, talks about the G-bombs, which are greens, beans, onions, both cooked and raw, mushrooms, cooked, berries, and seeds, nuts and seeds. Those each have individual anti-cancer properties. So if you're trying to prevent or even treat cancer, that's a nice thing to remember to have a little bit of every day of the G-bombs.
Fantastic. Thank you. I want to invite our folks who are viewing our webinar tonight to please go ahead and put your questions in the chat box, whether you're watching us on YouTube or Facebook. We'd love to take some audience questions. And while we're waiting for those to come in, we actually had polled some of our registrants prior to the event, and a number of people asked questions about supplements. What kinds of supplements should women take, or could women take at different points of their life? And I know with whole food plant-based nutrition, we talk about food first, but are there actually supplements that certain women should consider taking, and when is that? Dr.
So,
Scheuer, do you want to start us? Yeah.
Dr. Scheuer or Dr. Fontaine?
Dr. Scheuer, go ahead.
Okay, great. So if you are plant-based, there are a couple of things that you can consider. One is vitamin B12. Vitamin B12 is actually from microorganisms in the soil, and our soil has become so bad, and it's been contaminated, it's dying. So animals usually eat the soil, we eat the animals, we get B12, but actually they're now having to give vitamin B12 to the animals so that people can get it from there. Or, and we as plant-based eaters, we take our carrots and we wash it all off, or we don't drink out of streams anymore. So B12 is an important one to consider, especially if you're plant-based, but even if you're not. Vitamin D is really important. To be out in the sun is the best way to get it. But for me, I live in Colorado, and in the wintertime, I'm covered up and I don't get a lot of exposure to the sun. So I definitely do vitamin D in the wintertime. There are other ones that are questionable, like omega-3s. Lots of people use fish oil for omega-3s, which can help supposedly with Alzheimer's prevention, et cetera. But fish get their omega-3s by eating algae. So just do it straight from the algae. Cut out the middleman and don't have the contaminants of that. If you are plant-based for a long time, you tend not to eat a lot of salt, which is iodized. And unless you're eating a lot of sea vegetables like nori and things like that, you can have some iodine issues. But we can measure all of these. And at Plant Based TeleHealth, our doctors do measure some of these to make sure we're not giving you too much or too little. And then if women, particularly younger, if they're eating a lot of, if they're having heavy periods, you've got to look at their iron levels and make sure that they're not anemic for any reason. And you know, you want to have healthy non-heme iron. You don't want too much, which you can get from animal products, but there's lots of, you can get plenty from your veggies and things like that. So it's way better to get your vitamins and minerals from foods. That's the best way. If you're going to get them from supplements, first of all, read Dr. Greger's How Not to Die book. It's huge. 400 pages and has 3 pages on supplements. We try not to supplement too much, but if you do supplement, make sure that you're using supplements that are USP approved, that are third-party approved, so that you don't have contaminants in there. We're seeing a lot of heavy metal contaminants in lots of supplements and things that don't really have what they say they have.
Great. Dr. Fontaine, do you have anything to add on supplements or some of these little details?
Yeah, I think Dr. Scheuer went through pretty good. I think, like she said, for the vitamin B12 and D, but you also have to realize it's really important, even for people that are not plant-based. Whatever diet you have, you will realize that your vitamin D level, which we measure now on a regular basis yearly, are going down with age. Just me. I exercise outside and my vitamin D level was good, but it just started creeping down. So after 50, they encourage that we should be taking vitamin D and vitamin B12, even if you are not whole plant-based. The other thing that I would add maybe is, for women that are trying to get pregnant, we want to make sure they have folic acid so they can take a prenatal vitamin. Obviously, normally, if you are plant-based, you probably have enough folate in your diet, but it is very important because it helps to prevent what we call neural tube defects. So spina bifida is associated with a lack of folic acid, and into a regular diet, you sometimes don't have enough. There's a lot of food that are fortified now with folic acid, but usually when I'm have younger individuals that are in the planning of pregnancy, I encourage them to take folic acid.
Great. We had a question come up from our audience. Are there any specific foods that help with painful cramping? Especially if you're, for somebody who's already plant-based but still experiencing cramping, what might they do a little differently to support this? And I know, Dr. Scheuer, you just mentioned that heavy periods might be a sign of anemia or might be implicated with it somehow. So are these things connected?
Well,
So,
yeah,
go
ahead.
ahead.
All right, Dr. Scheuer, you go first.
So the heavy periods can cause anemia because you're bleeding so much. But yes, you want to make sure you're having a lot of green leafy vegetables. Again, the soy products make a huge difference on cramping. You want as much, you can have anti-inflammatory foods. There are foods like turmeric with a little bit of black pepper to get the curcumin going, which will help a little bit with that. So I think those are what I would start with, but then Dr. Fontaine can talk some more.
Yeah. So just like we said earlier, the fiber is important because oftentimes you have a heavy period because of estrogen. Fiber helps to kind of, dilute, if I can say, the estrogen level. So make sure you eat enough. We don't eat enough fiber. The demand in our body is, and we probably eat about 20-30% in a regular diet. So you got to push the fiber and anti-inflammatory of all the things that Dr. Scheuer said. We can also add maybe some flaxseed and chia seed that could be helpful. Just to get used to a whole plant-based diet will have an impact on your period. They will change and they will get better and the cramp will get less. And if not, then obviously there is some anti-inflammatory medication that could be used, but we hopefully can help with the diet first.
Great. And is it the case that if somebody is still retaining some weight, they haven't reached their ideal weight yet, they might still be having the effect of the estrogen produced by the excess fat? So it may take some time to get those compounds out of the system. Is that right?
It does take a certain time. It tends to grab and stays in your system, in the liver. So it is important to differentiate between vegan and whole plant based. A lot of people eat vegan. I would say that 80% of people that I see, they think they're whole plant based, but they're vegan, or they say they're vegan. So the food industry is there. Now that they know that we're interested by whole plant-based, offering all sorts of processed vegan food that may not be as helpful as you think. So be very careful. The best food that you can, take from real produce as opposed to something that has been processed will have a significant impact in your estrogen level.
Excellent. We had another question come in. Supplementing with Irish moss for nutrition. Now, Irish moss, I believe, is just one form of seaweed. There are many different kinds. Do you happen to know whether Irish moss has special properties versus the others?
I'm sorry, I wish I could help. But you know what? It's a good example of we are trying to educate people to realize that it's a whole that is important, not a specific one thing in what we eat. So it seems that people are coming to me with so much information that is so detailed. And if I'm trying to look at them and their entire lifestyle, I can help them so much as opposed to go to that little. So unfortunately, I don't know what this Irish, I don't know if it's helpful more than anything else.
No problem. Thank you.
I agree. I don't know. I could look into it. There are some websites that are helpful, which I can send your way in the future. But
sure. We've been talking about doing a seaweed special, so that'll be in our cards for the next year. Very good. And someone brought up this idea of seed cycling, which I had to Google actually to figure out what it is. Seed cycling, rotating between different edible seeds in the diet at different times of the menstrual cycle. Have you heard of this? Do you know if this is helpful in any way?
I know about bicycling, but I don't know about seed cycling. Like I told you, thank you, Jacqueline. I wish I could help you. I would have to check that. I don't know if there's enough study on this, but hey, I'm not familiar. I wish I could help you on that.
Yeah,
And I
and
don't
this
know
may
much
be
about this either, but I think it does bring up a good point. You don't want to just be on one thing. You don't want to just eat kale. You want to eat a variety of leafy greens. And somebody asked where we get calcium from besides milk, and it's a variety of leafy greens have tons of calcium. You know, beet greens, rhubarb tops, things like that. Almonds, cocoa, they all have a lot of calcium. So you can get it from a variety of foods. And so with the seed cycling, I don't know very much about it, but I can imagine that, you know, you want broccoli seeds and you want chia seeds and you want different kinds of seeds. But again, both of us would need to look into that a little bit more
Yeah, but I think that your message is loud and clear. It is the overall dietary pattern that matters most, and not these particular superfoods or heroes in the diet. So, and that's really critical when we talk about whole food nutrition. The holism, it really wins the day.
Exactly.
One other question, not necessarily a women's health question, but for anybody who might be having leaky gut, which we can, one if you would like to explain a little bit, is brown or black rice risky? And I'm assuming that might be because this person is addressing the arsenic content in the rice. M&M, if you want to put in the chat box any clarification, go for it. But would you like to, one of you like to explain what leaky gut is and how, actually this goes to the topic of the autoimmune diseases that women often face. Dr. Scheuer, do you want to take this one?
Sure. So leaky gut, we talk about the gut has a layer of cells that separates the outside from the inside. And those are usually really tightly bound so that as food comes in, the food is absorbed through the cells itself. But if the gut is weak because it doesn't have good gut microbiome, which is all the trillions and trillions of different bacteria and viruses and all that stuff that's in your gut, we're really the hosts for, that aren't feeding the gut well, you can get a break between those cells in the gut. And then the proteins go straight through into our blood vessels, and we get inflammation, and that's not good. So you want a very healthy and good microbiome, which will keep that gut from being leaky and keep those cells really adherent. So some people talk about, some people have issues with certain foods that can cause a leaky gut. Fiber is the biggest and most important thing to feed the gut microbiome to keep your gut strong. And I don't know your point too with the arsenic is an issue with certain rices. You want to get rices from areas around the country and the world that don't have a lot of arsenic. But if you have a gluten issue, which can be a very serious issue for some people, then you want to be really careful about gluten. And generally, rices aren't a problem for people with gluten issues, like brown rices and things. You'd have to see also, though, if it's really truly a gluten issue or if it's certain proteins in the black or the other rice that you were mentioning. And what you could do is have the cleanest, healthiest diet to improve your gut and heal your gut for a while. Once your gut is healed, add a little bit of those products in, like the black rice, and see if that causes any gut cramping. If it does, stop it. Wait for 2 weeks, let all that clear up again, try it again. If it happens again, then it's not healthy for you. And so that's how I would do that.
Great, thank you. We also just had a question about hyperthyroid, and we could address the thyroid for probably another hour, but maybe just a quickie on, what does nutrition do for our thyroid health, whether it's hypothyroid or hyperthyroid, and if there are specific tips for people with one or the other, that would be great.
I'm going to let Dr. Scheuer mention that. I think she's better than I am.
Great.
And this is just like anything else. You want to have an anti-inflammatory diet. So you do not want anything that will make inflammation in your body, which will affect your thyroid, which can affect hyper and hypothyroidism. Those are very interesting and tough issues to deal with. And I have seen people who are both hyper and hypothyroid get better on a very strict plant-based diet, which is great. So, but that's individual, and you should talk to your doctor, and the people at Plant Based TeleHealth can certainly help you with that.
Yes, so hypothyroidism is much more common than hyper. So that's usually what we see more in the practice. Actually, women has a higher tendency of having hypothyroidism. And yes, we can help. Usually at the very beginning, you can sometimes, if it's really borderline, changing to a plant-based diet. But I will admit that for the majority of people have hypothyroidism, they need to stay on medication. I'm a good example. I have hypothyroidism and I've been on medication for 25 years. Even the stays about the same, but with my plant-based diet. But you need to be careful and not being over wanted to stop your medication when you need it. So just to be careful.
Mm-hmm. Excellent. Yes, we have some members of our community who have been mentoring folks in our Jumpstart programs who have personally reversed hyper and hypothyroidism, and it's just been remarkable. I think, though, at certain stages of the disease, right? If you're reliant on the medication because the thyroid just is not functioning anymore.
So it has to do with whether the cells are damaged or destroyed. Mm-hmm. If they're destroyed, you can't. But if they're just damaged, you can improve the health of the cells and then adjust your medicines appropriately. We want you to be on the least that works. We're grateful to have medications for when we need them, but we love to not have to use them if you don't have to. But we're so lucky that we have it, because there are times when you absolutely need it. But keeping your body as healthy as possible so that you use the least that works is great. And again, we've also seen some reversal, which is great.
Fantastic. So here's a final question from our audience, and then we'll wrap up. Nicole asks, when you're visiting an OBGYN, this is for you, Dr. Fontaine, what are the kinds of questions to bring up or tests to do to make sure that we're hitting what we need to do? And this is asking you now, with your lens of lifestyle medicine on, what's different about visits to the gynecologist than before?
Well, I mean, like you said, it seems that there's a two avenue here. Most of the people that will visit as OBGYN do not have the information that Dr. Scheuer and I have. So they could be potentially reluctant. They could be open, but a lot of them are reluctant for a simple reason that they don't know. Physicians do not have much education in nutrition. So you may make them feel uncomfortable if you go there and ask all the questions that I would suggest, or suggest some of the labs. Not that we do extensive lab. When you feel good, we don't tend to overdo it. But, in that question, I would have a tendency to say, listen, when you go see your OBGYN, they're going to do some, exam that are related to you. And if you want to discuss lifestyle and a plant-based, please come to see us. This is what we do. Our role is, like I said at the beginning, is to keep you healthy as much as possible. And therefore, I think that we're working not only a primary care OBGYN, but at least to visit somebody that does lifestyle and plant-based yearly should be present for all of you.
Thank you. Yeah, I know from my experience that when I went back to my doctor and said, I just don't have this endometriosis thing anymore, she said, I don't think that food could possibly have done anything.
It was like that too.
Yeah.
At the beginning, I was very, I didn't believe that. So until you see it yourself and you practice, so it will take a little bit of time before the typical medical school will. But it's getting better. We have more and more physicians that are interested with lifestyle, trying to understand plant-based. So we're growing.
Excellent. Yeah. So let's talk. Let's have some closing thoughts for the women and any allies in the audience who may not identify as women. Stepping back from all of these details that we talked about tonight, what do you most want women to take away from our discussion to live better and healthier lives? Dr. Scheuer, will you start?
Well, definitely live the lifestyle that you would want your children to live, being happy, being healthy, feeding your body good nutrition and making sure you're not poisoning your body with bad nutrition. Making sure you have a community that you can be involved with, get out in nature, move, kind of live a simpler lifestyle, get rid of some of that stress or learn how to manage some of that stress, because we do have stress in our lives. And we all need help sometimes. And if you need some help, come to us at Plant Based TeleHealth. We actually have wonderful, wonderful people who live the lifestyle they're trying to get their patients to live. And we have a great brain trust here. If I have a question that I don't know the answer to, I talk to Dr. Fontaine or any of the other doctors there. So when you come to one of us, you come to all of us. And so get the help you need so that you can be the best woman you can be, or best non-woman or man that you can be, or whatever. And just be positive to yourself and to the world.
Beautiful. Dr. Fontaine?
So well said. What am I going to say after all this important message? I think what I'd like maybe to add is, when you think about the importance of the whole, the life cycle, and women are so important in health, like we said earlier, of the whole family. So take time for us. We are more interested, not necessarily with the sick disease, but to keep you healthy. I can see I'm starting to have women coming to see me and they say, I'm so sorry to come to see you. I'm not sick. And I say, that's exactly what I want. I want you to stay healthy as long as possible. So please come to see us. Like, Dr. Scheuer said, the whole group are amazing physicians. We're there to encourage you to stay healthy, optimal health for your entire life.
Beautiful words. Thank you both so much for your wisdom and for your pioneering spirit and practice. This is so important. And to know that you are two of how many doctors now at the Plant Based TeleHealth? How many?
We're 9 or 10. How many are we? 10?
Yeah, we're getting more and more because we want to make sure we have somebody in every state, and we want to make sure that we have. You can look at our different bios and hook up with the person that you feel most comfortable with, because we have a variety of great folks, different languages, different interests, but we all, like I said, work well together to help everybody else.
It's an amazing, amazing resource. And especially as the field is still settling and growing, knowing that we have doctors like you out there who specialize in women's health and have gone through this personal experience yourself in changing how you live and how you eat. I think it brings us all a sense of joy to know that we have resources like you in the community. Thank you so much.
Well, I'm so pleased of having, Plant Powered Metro New York, because that's so important to reach everyone. We need to spread this around the world because we all want to be happier and healthier.
Absolutely.
So thank you for what you do.
Of course. Thank you.
And thank you for having us for a guest. It's really nice. And please, for your guests, maybe put plantbasedtelehealth.com. They can find us and see who's available for New York. I know Dr. Scheuer and myself can do New York, and there's other of our physicians will be happy to see you.
Wonderful. Thank you. So to all of our viewers, if you are looking for a next step, this is where Plant Powered Metro New York comes in. Definitely visit their website. And if you'd like to learn more and connect with them about, seeing one of the doctors in the practice, by all means, please do. What we offer on a community level is to take all of the fantastic medical advice and the evidence-based research and help you put it into practice in your day-to-day lives, and to find community, which Dr. Scheuer mentioned a few times here. Community is the secret sauce of behavior change. And if we want to go through change and have that kind of the backing this is where we come in. So take a look at our events calendar on our website, which is now shared in the feed. You'll find coming up in June, we have on Thursday, June 9th, one of our monthly Get Started with Whole Food Plant-Based Nutrition virtual events where you get to dive in deep with one of our nutrition educators and a culinary educator to learn more about this lifestyle and how to make it happen in your home. We are also going to be running our next Jumpstart in Spanish in June, and details are now up on our website as well. And we'll have, in honor of Pride Month, a Gay Men's Health and Sexual Performance webinar. That will be on Tuesday, June 14th. Join us back here with Dr. David Dunaev and Dr. Jeff Schrager for a deep dive into the other sex, or one of the other sexes. Let's be a little bit more open-tent about all of this. And we hope you'll join us, because there's so much to learn and so much to appreciate about the role of food in our health and in our healing. And I hope that you'll join us on this fantastic journey. Have a great night to your health.